When you're testing for visual language, meaning reading deficits, some of the tasks we use are you would have some cards with words on them. You could spread those cards out in front of the patient and essentially just say, point to this word, and you give them the word. And of course, the fewer the options, the easier the task is. But also, the more options, the longer it takes, the more they have to scan to find the answer, the more that's going to rely on intact short-term memory to remember the word that you're wanting them to find. And it's going to rely more on their intact attention because they're having to sustain their attention on this task to scroll through the words to find the correct word on the card to point to that you've given them. You can give them phrases or sentences to read, and those sentences might be a command so that they don't have to respond verbally, such as make a fist. So they read the sentence make a fist, and then they're able to do this and show you that they understand the sentence. Some examples I have of things tasks that I use to test for low-level reading or going up through some pretty high-level reading basically is, what's this? And so they're going to show me their hand. That's correct. I'm going to go, all right, what's this? They're going to point to their shoulder if they understand it and they can't say it. If they can say it, can produce the word, then that's great. Do what this says, and they're going to make the fist to show me they understand. How many ears does a man have? They're going to hold up 2 for 2 fingers if they can't verbally produce. Show what you do if your nose starts to itch. Point to the second word in the sentence. So the sentences are getting longer and more complex, leading up to show which words in this sentence begin with the first letter of the alphabet. So they have to read through it all, get to the end of it, remember what they're supposed to be doing, go back to the beginning and scan through looking for all the letters all the words that start with A. So you're getting the more complex your reading task, the more you're roping in forms of cognition. And this is a very difficult one, and most people don't get this. Follow only the first and third of the following directions. Hold up one finger. Touch your nose, put your hand down beside you. So they're going to read that quietly. And if they understand it exactly, they're going to hold up one finger and then they're going to put their hand down. But if they're able to do this, normally what they'll do is they'll read through the directions and then they'll hold up one finger, they'll touch their nose, and then they'll put their hand down beside them. And that shows you that their reading is intact, but their attention or their memory is flawed because were unable to retain the directions at the front end of the command. And you'll usually have a functional reading task. Examples of this is having some coupons, having a menu. I use this image of a pill bottle, and the question is, how many pills does he take in a day? And so they have to look at this, zero in on, take 2 tablets 2 times a day, do the math, and tell me 4. So it's not so much a reading task as it is reading, sustained attention, as well as some low-level math in there. But that's more functional because more often than not, when you're reading for like an activity of daily living, it's not going to be a pure reading task. There's going to be some other components of cognition thrown in there, roped in cognition. All right, Now I want you to think about different reading tasks, things, skills that you need to accomplish them. So someone reading quietly, if you give them a passage and you say, "Here, read this quietly to yourself," they read it and they look up. You don't know if they actually understood anything or if they actually read anything. So you need to come at this in a different way to test their reading. So you can give them the passage and you can say, "Here, read this out loud." Quicksand is not as dangerous as most people think. It is loose sand mixed with water that cannot run off. So when a person is reading aloud, if they're doing it successfully, then they're showing you intact visual reception of language, and they're showing you intact verbal expression of those words that they're seeing. And that is enabled by an intact arcuate fasciculus running from the angular gyrus anteriorly to Broca's area. It allows you to say aloud verbatim the words that you see on the page. You can say, "I want you to read this quietly to yourself, and then I'm going to take it away and ask you questions about it." So then they read it quietly to themselves, and then you take it away or cover it up, and then you ask them questions. But you probably don't want to ask them questions in a way that requires them to have expressive language, because that's going to make the task that much more complicated. You're going to rope in expression as well as reception and cognition. Let me explain. So when someone reads something quietly and then you ask them questions, you probably want to do yes/no questions. So I'm going to ask you yes/no questions about what you read and see if you're able to respond correctly. And they could nod yes or no. So they're not required to produce any verbal expression. In order to respond correctly, though, they will have needed intact attention to be able to complete the task, sustained attention. They needed to sustain their attention on the task long enough to complete the reading. Then they need enough memory, short-term memory, to be able to hold information in their head, to be able to give it back to you and respond correctly to your questions. So reading quietly for comprehension. It's more complicated than you think, because you're not only testing reading, you're testing reading, you're testing sustained attention and short-term memory. And if they're going to respond verbally to your questions, then you're bringing in verbal expression as well. So for them to complete this task successfully, they need all these abilities intact. And if one of them isn't intact, then maybe they may not be responding to your questions appropriately. But that doesn't tell you they have reading deficits. That tells you they have a deficit at some point that is negatively affecting their reading. And you have to drill down a little bit more to isolate it to reading or sustained attention or short-term memory. Now, you can ask them to read the passage aloud, and then you take the passage back and ask them questions. That is going to require them to have intact visual reception, intact verbal expression, because they're saying it out loud, and then intact sustained attention and intact short-term memory for them to respond to your questions appropriately. So you have to be aware of when you ask a patient to do something, you need to be aware of all the background skills that they have to bring to bear to accomplish the thing that you're asking, so that you can be sensitive to the possibility of deficits in those other areas. So a couple of low-level reading tasks would be where you you have cards with words on them and you have pictures, and the patient has to match the written word to the picture that it goes with. So matching words to pictures, and obviously the same thing, the more words and pictures you have, the more difficult the task is going to be. You can have a sentence completion task where it's basically like a multiple choice, where it's like a sentence, you sit in a blank, and then under it, there's a few options, and the patient points to the correct answer. Both of these would be pure visual reception tasks. Pretty pure. All right, so moving now into tasks that we use testing for cognition. As SLPs, we test for and provide therapy for a lot of different facets of cognition. Low-level cognitive deficits such as orientation deficits, hemispatial neglect, attention deficits, memory deficits, simple problem solving, simple math. And if you have these lower level cognitive skills intact, then we move into rehabilitating those higher levels of function, such as higher levels of problem solving, convergent thinking, convergent naming, divergent naming. So convergent naming is I give you many members of a category, and you take all those and you converge onto what is the name of the category. Divergent naming is the opposite. I give you the category, and then you produce category members. Divergent thinking is being able to generate more than one solution to a problem. One of the things that you'll find in your brain damaged population is that oftentimes they may have pretty intact problem solving, but it's extremely narrow. So they may be able to generate one solution to a problem, to like a simple problem, but once they generate that one solution, it's like they're blinded to all other possible solutions to that problem. There's a lack of flexibility in their thinking, in their cognition. And this rehabilitation of cognition, if patients are able to keep improving long enough, it escalates to the point where you are targeting divided attention, which is multitasking. You're targeting inferencing and executive functioning. And these are high-level cognitive abilities. And it's not common that patients get to that point, because you can be a pretty functional human being and still have some deficits in those higher level abilities. So one of the things I harp on a lot is always test for neglect. And neglect is usually tested quite informally, meaning basically sort of like we use screening procedures. There's not a lot of like standardized testing for neglect, although there is some. Screening for neglect usually exists in the form of a line cancellation task or some other cancellation task, having the patient copy line drawings, or maybe ask them to read aloud, or doing something that would display their neglect if they had it, and displays their lack of neglect if they don't have it. So a line cancellation task. This is extremely easy. I don't even carry it with me pre-made. I take a blank sheet of paper and I start putting marks going one way all over the paper. And I make sure that I've gotten the corners. And basically, you take this and you put it in front of the patient, and I'll put the first mark for them, and I'll do it in what I know to be their non-neglected space. So I'll make an X, and then I'll put the paper down in front of them. I'll hand them the pen, And I'll say, okay, you do that. Make the rest of these marks, make them all X's. And if they have neglect, they will all try to do this. If I have left neglect, all right, then now when you give them the sheet of paper, any sheet of paper or any task you want them to work on, if they have neglect, so we'll say if I have left neglect, so this is my left side, so this is my intact side. When you push this in front of them, they're going to do this, and then they're going to try to drag it without thinking into their non-neglected field. So if you see them do this, then that's going to indicate to you that they probably have neglect, or maybe they have visual field cuts. So you want to present it, and you're going to keep your hands on the sheet of paper to keep them from pulling it one way. And if they have a neglect, then when they complete the task, it's probably going to look like this if they have left neglect. This is the left side. This is the right side. So you'll see that they have marked, they have made X's on the right side, but not on the left. And sometimes because the personal left quadrant is the most likely quadrant to be neglected, you might see something like this. Well, like this, where the left personal quadrant is the place that is most neglected. Another quick screening. Make a line, give them the pen and say, put a dash in the middle of the line. So if they don't have neglect, they're gonna put a mark right in the middle of the line. I guess it'd be more like right there. If they have neglect, then they're going to take the half that they see and they're going to put the mark right there. That indicates to you that they're neglecting this side of the paper, which would be the left side in this example. Now, the more marks you put on the page for them to cancel out, the more difficult the task is going to be, because the longer they have to sustain their attention on it, the longer they have to remember what it is that you're asking them to do. But this is a pretty easy task because there's nothing competing with the X's. A more difficult cancellation task, or task that we use for neglect, this is the bells task. And there's a few of these, and I think I've got them posted on Canvas for you. So save them because they're really nice. You will use them all the time. But this would be a little bit more difficult of a task, where you would print it out, the same thing. You would give it to the patient and you would circle one bell. You say, here's the bell. And then you would say, putting the sheet of paper in front of them and holding it there so it's at midline. And then you would say, circle all the bells. So they have to go through and circle all the bells, and there are a lot of bells. All right, so this might take quite a while. And there's other competing shapes, so they might get distracted. So this is a slightly more difficult task that you could use for screening for neglect. And it's going to take longer because there's a lot more bells. And having the patients draw a daisy or copy a picture of a house. So you could draw a house, or you could ask them to simply draw a house from memory. But the shapes that we usually ask them to draw are the house, the daisy, and then the clock task as well. You guys have already seen an example of the clock task. And once again, I don't carry a pre-printed circle with me. I just draw a circle. And I might even put the first number up there, 12. And I'll hand it to them, and I'll hold it in front of them, and I'll say, draw in the rest of the numbers on the clock. Another way is I could just have a sheet of paper here. And when we're talking about those point 2 tasks earlier, testing for auditory reception of language, point to the car, point to the spoon, point to the bed, and they're hearing each of those individual words and pointing to the object, and thereby showing you that they understand those individual words. I can also use this task to test for neglect, just by simply telling them to point to the objects on one side versus the other. I need to be sure that they have intact receptive language. But that being said, all these other tasks I've talked about, to understand the instructions that the clinician is giving them, they need to have some level of receptive language as well. We also use reading tasks to test for neglect. And what you'll see is that with neglect, they will essentially ignore one half of the page, and they'll only read the text on the half of the page that they're not neglecting, which creates some obvious problems when they're reading out loud. So if someone was going to read this out loud to me and they had left neglect, so they're neglecting this side of the page, essentially what's going to come out of their mouth is Juris, as most people think. It is water that cannot run off. The sand is caused by the if you are caught in quicksand and try to float on top of it, as you should pull slowly and feet. Quicksand will support the oars. If you struggle, however, it pulls you down. Heavy automobiles will sink in water. All right. So often when you ask them to read and it doesn't make any sense, they won't pick up on the fact that it doesn't make any sense. You probably have to cue them, say like, well, what did you think about that? Did you understand what it was talking about? Because they're going to have that anosognosia, and they're really going to be pretty oblivious to what's going on. And so this is one way in which you can try to dial them in on the fact that they're missing half of the page. So those are basically a lot of paper and pencil tasks. And if you notice, everything I described pretty much is happening within the personal space. So you're not testing in any of those tasks, you're not testing for neglect of the extra personal space. This is to say you want to use more than one or two quick diagnostic tasks if possible. And this may be something as simple as backing up and going to the corners of their rooms and presenting information and asking them to respond to what you're presenting, so that you know that they're not neglecting those areas of extra personal space that are further away. You want to try to zero in on where in their attentional field the neglect is occurring. So don't just find that there is neglect and stop there. I mean, that's great. That gives everyone a really good idea of what's going on, but do your best to try to zero in on where the neglect, what area of their attentional field is neglected and is neglected the most. And that gives you a good idea of how to approach presenting stimuli in therapy, because you can ease your way into targeting to bringing their attention into their more heavily neglected spaces. A real powerful tool for evaluating and providing therapy for, which we're going to get to in a few lectures, is the baking pan task. So I don't actually have my baking pan or my blocks anymore, which is sad, but this is what they looked like. So, and this was a cookie sheet about like this. So it's a pretty big cookie sheet. So for the baking pan task, to test for neglect, you could put blocks, different areas on the baking pan. And then you center the baking pan in front of the patient and ask them to hand you all the blocks and see if they're able to do that. And then maybe you do the opposite. Maybe you give them the blocks and say, spread these out within the cookie pan, within the cookie sheet, within the baking pan, like you're making cookies, like spread them evenly. And how they do that is going to indicate to you as well presence or absence of neglect. And the bigger the pan, the harder it's going to be for someone with neglect. So if you imagine that this pan is only this big, then there's only this much of the pan, there's much less of the pan that would exist within their potentially neglected field. So that would be a much easier task with a smaller pan. So the bigger the pan that you use in this task, the more difficult the task can be. Also, a good way to look for the presence of neglect is essentially to watch the patient go about some of their activities of daily living. There is a scale called the Katharine Bergigo scale, and it is behavioral assessment of neglect, meaning just what I said. You watch the patient go about some of their activities of daily living, shaving or putting on their makeup, adjusting their sleeves, eating, cleaning food out of their mouth. Can they look toward the left? Do they forget about body parts at times? And this gives you a very strong indication of the presence or the absence or neglect, and it probably gives you a good idea of where within their attentional field the neglect is strongest or weakest. But there's a good chance that depending on what facility you're in, it may be more appropriate for the OTs to be completing this assessment than you. So this is something you might give to an occupational therapist and ask them to do for you. There used to exist on the internet the Center of Cancellation free software for neglect diagnosis. I'm sure it's on there somewhere, but it's not where it used to be. So, and if this doesn't exist, I'm sure there has to be something just like it and updated that exists. So essentially, this is a software, and this is where the Bell's task and some of the other visual scanning tasks that I have uploaded for you on Canvas, where those PDFs come from. So essentially how this works is you would take the Bell's task and you would present it to the patient. And after they scored it, you would take that hard copy and you would pull up the software program and you would pull up the software's virtual image of the Bell's task and you would click on all the bells that they successfully identified. And when you did, that bell would turn green like this. And the ones that you didn't click on would leave red. And then essentially you hit return and that program generates a numerical score indicating to you severity of right or left neglect based on the number and location of the bells that went neglected when you gave them the Bell's task or whatever task you gave them. There's 2 or 3 or maybe 4. So this is an elegant little piece of software. I'm sure it exists somewhere still. And it's cool because it gives you an actual numerical score for severity of neglect. And that is something that you don't get otherwise.